Spinal Truth Show weekly podcast edition. I am your host, Dr. Caleb Slater, here with Chris, our videographer, filmographer, everything in between, and Jill, our PR marketing specialist. This week's episode is talking about sleep. And Chris, you seem pretty excited to talk about sleep.
Sleep is great. It's one of my favorite things to do.
You love sleep.
I love sleep.
So what are some things that you want to talk about for sleep?
I have many things to talk about with sleep because I often struggle with sleep, even though I love it so much. But there's many questions for someone like you that I don't often get the chance to ask.
All right.
Because sleep is like this thing where like you have your mattress, and depending, I've heard so many things. Well, you got to have a firm mattress or not a soft mattress, and how that can affect your sleep. You have to sleep on your back. You got to sleep on your side. You got to sleep with this kind of pillow. You got to sleep not under your. So many different things. I know I'm doing it wrong. There are times where I wake up in the morning and I'm like, that was a great sleep. There are many times where I wake up in the morning where it wasn't a great sleep. My neck hurts. All kinds of things I know I'm doing wrong with sleep.
Okay. And you're right. Like the mattress type, the sleeping position, the pillow, hot, cold. The room, dark. Right. All that stuff is definitely worth talking about. I prefer to look at sleep, however, based on your symptoms, right? So you say you wake up in the morning often with neck pain, stiffness, right?
Yeah.
So you want to address sleep through that lens, not necessarily because the problem is with mattresses and stuff like that. Like some people might like a firm mattress. Some people might like a soft mattress. My wife loves a soft mattress, right? We tried a Tempur-Pedic bed. Yeah. She loved it. I sank in too much and I didn't like it. Some people might like a big thick pillow. Me and my wife both like that's about as thin of pillow as possible. And we even have trouble finding that pillow out there for us. Okay. And it also depends too on what position sleeper you are. Are you a stomach sleeper? Are you a back sleeper? Are you a side sleeper? Do you roll around a lot at night? So stuff like that. So because of that, it's very generic advice. But if you have a specific problem, now you can get a little bit more specific with your advice, right?
Sure.
So often for neck pain, and then you said stiff in the morning, or was it like fatigue in the morning?
Often like fatigue.
Okay, so fatigue is a great one,
okay,
right? Because most people don't realize that a lot of times that like fatigue in the morning is a big issue coming from your spine. So often at night when you sleep, most people these days are side sleepers, right? And I say these days, by our age, right? Anytime past probably 25, you're sleeping on your side.
Yeah. Well, I sleep on my stomach.
Okay.
Yeah.
How often?
Stomach sleeper. Pretty much every time.
Okay.
Yeah.
Well, so for most people though, the sleeping on their side, their thoracic spine is in flexion throughout the whole night. Okay, which means your shoulders are rounded forward, your shoulders are caved in together. And this actually causes a lot of like upper back pain. And this area, when it's symptomatic, will actually lead to a lot of like chronic fatigue. So, we have a lot of people, I wrote a book, and in the book I have a chapter about brain fog. And these patients were having like general fatigue, malaise, like difficulty concentrating, difficulty with energy levels, especially in the morning. Mm-hmm. And the area of their spine that was most problematic was the thoracic spine, so that like mid-shoulder blade area. And doing a simple exercise in the morning can really, really mitigate that. And maybe even doing it before you go to bed or throughout the day can actually help you get a better night's sleep. And it's just a extension of that area over a foam roller. And if you're on our, social media, TikTok, Instagram, we show this exercise a good amount. And if you do it right, you basically undo that sleep position where your shoulders are rounded, your shoulders are coming together. So if you're waking up in the morning and you're fatigued, this is something that I suggest like just rolling out of bed and doing, and you'd be surprised on how quickly your energy just like really gets back up to speed.
Comes back to life. Now, is it affected by, if you're sleeping on your side, I assume you probably have your arm or something like that underneath. I often do that with my arm, and it causes I feel like shoulder pain and neck pain in some ways. Now, I'm usually on my stomach. But if you're a side sleeper, I feel like you're probably putting one or two pillows certain places to kind of prop your body up in ways.
Yeah, so, all right. So let's say you're a side sleeper. What's the best position to sleep in?
Yeah.
And The problem is that the real answer is there isn't one. Okay, it's like when people say, "What's the best position to sit in for like a office desk?" Right? There isn't one. Your body's designed to move. It needs to move. So like looking down too much can be bad. Looking up too much can be bad. Leaning forward too much can be bad. Leaning backwards too much can be bad. Like your body needs to move and change positions. It's the same thing with sleep. And that's why you move around at night, right?
Yeah.
The real answer is that your body should be flexible enough, healthy enough to tolerate positions just like you did when you were younger for a long period of time, to tolerate laying on the floor, to tolerate sleeping with a thicker pillow or a thinner pillow. But there are some positions that are less irritating in general than others. And if you're a side sleeper, you want a pillow that supports your neck and head where it's just slightly tilted towards the bed. So if you're laying on your right side, your head's slightly tilted towards the bed, just slightly.
Not propped up the other way.
Not propped up. So most people have like two pillows and it's pushing their head up. That's not what you want. So that stretches your neck and puts a lot of strain and tension and weight through your neck throughout the night. So that's something that's a pretty easy fix, right? And you can have your partner look at you and say, or you could look in the mirror, or, I don't know, take a selfie, right? See what position your neck is in.
Yeah.
But just slightly less than neutral.
All right, because I've definitely had where I wake up in the morning and I can like barely turn my neck.
Yeah.
And I assume it's probably because my neck is kind of facing out away from the bed when I'm sleeping sometimes. And again, stretching it.
Yeah, and again, the position that you're in definitely attributes it to it. Yeah. But the way you went to bed, that's really what I think is more important.
Okay.
So did you go to bed flexible? Did you do exercises that got you away from this computer position, this TikTok position, this cell phone position, this driving position, this cooking position, right? It's the same position where you're leaning forward, you're rounding your shoulders, you're reaching your head forward. Did you do anything before you went to bed to undo that throughout the day?
Well, I am the pinnacle of health. No, probably didn't at all. Yeah.
So, and now you go to sleep and you maintain that position.
Just compounding.
Right. So it's just compounding over and over and over and over again.
Gotcha. Yeah, though that makes a lot of sense. So in reality, the pillow doesn't matter. The pillow choice doesn't matter. It's just trying to maintain that kind of position for your back. Or
right. Yeah. So it's maintaining a basically about as neutral a position as possible. But again, it's your body needs to be able to move around.
Gotcha.
So
if you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
Another thing that you can do too if you're a side sleeper, and this is something that I personally do ever since I had shoulder surgery since college, is if you're a side sleeper, hug a big thick pillow or a big thick person, right? So it depends, what you have out there. But you want your elbow somewhere around midline with your body. You don't want it collapsing down. So if my elbow collapses down, my arm collapses down, my shoulders come together.
But you're, okay, so I'm already doing something wrong.
Yeah.
Continue.
So you want a pillow, so if I'm laying on my right side, my left arm is hugging a big thick pillow, right? And I want my arm kind of out here. This is actually an open pack position for your shoulder. Open pack, so it refers to a position of the joints. The joints have closed pack and open pack. Open pack is basically the position of least resistance for the joint. So this position right here is an open pack position for the shoulder. So it puts less stress on the shoulder, which also puts less stress on the neck, but it also, that pillow doesn't allow your shoulder to collapse together, which puts a lot of strain on your upper back.
Yeah, that's a visual, if you're just a listener, you'll have to check out. But question for you about that, what about if you are someone who does use their elbow but puts it underneath their head?
So again, right? Like there's people out there that sleep like this and that's the only way they can sleep. That's fine. You should be able to tolerate any position.
Yeah.
If you're not tolerating a position, it's probably because you're doing that too much throughout the day. You're not undoing it, and now you're going to sleep and you are just compounding it with more over time.
Yeah, that makes sense. One thing I do often as well, and I think this is like the official medical term, is I have the Jimmy legs. I'm just, because my girlfriend will be like, why are you moving your feet? Why are you moving your legs?
And so, and you're right, Jimmy legs is the official medical term.
Okay, that's what I thought.
So, 2 leg symptoms, and again, this is why I like talking about sleep in the terms of symptoms. Okay. So, restless leg syndrome is basically your legs moving around. You're feeling like unrest, tingly, numb, maybe even some pain. You feel like you need to keep moving it around, or you just feel unease, like unsettled, right? If you look up restless leg syndrome and the cause is just like a lot of syndromes out there, no known cause. And they say anything from inflammatory, genetics, to environmental, obviously to, it could be neurological. They also will say dietary, is there a chemical imbalance? So for like cramping and restless leg, do you have calcium, potassium, sodium? Are you well hydrated and stuff like that? So there's all of these potential causes, but nobody tells people that a problem in your spine can cause these same symptoms, and it actually likely causes these same symptoms. Because if you look it up, you will see some stuff that indicates where a spine issue can lead to restless leg syndrome and cramps in the legs at night. Symptoms like spinal stenosis, or conditions like spinal stenosis, which is basically compression on the nerve or the spinal cord, that'll be cited. Degenerative disc disease, herniations, pushing on the nerve, that'll be cited. But for whatever reason in the medical world, when you go to your doctor and you say, I have the jimmies, right, they first ask about, nutrition, probably do blood work, and then they tell you some stuff that you can do at home, hydrate, take in some vitamins or some minerals and stuff like that, right? Which is probably where you should start, because it's pretty easy, and if it works, it should work right away.
Okay.
Right? And this is another thing that I want to get out to people. If you've tried, if somebody told you, well, maybe you're dehydrated.
Yeah.
All right, well then drinking water solves that issue, right? And then maybe it's not dehydration, maybe it's an imbalance of minerals, electrolytes.
Okay.
All right, well then taking in the electrolyte mineral that you need, so sodium, potassium, magnesium, calcium, whatever, should pretty immediately, at least within 2-3 days.
Okay, that was going to be my question. How quick would that show?
I'd give it 2-3 days, right? 2-3 days of taking one of these supplements or whatever. If you're not seeing that immediate change, all right, that's not your issue.
Right.
Okay? So now, if that's not your issue, what's the next most logical? And for me, it's your spine. And if you look this up, it'll say stuff like prolonged standing throughout the day can lead to this.
Okay.
Well, why? Why does prolonged standing lead to this? Well, when you stand, your spine is in extension. When it's in extension, it actually puts some pressure on the nerves in the back, and it compresses them. And then when you go to sleep, most of the time, most of the positions that you sleep in, on your back, on your stomach, and even on your side, unless your knees are cocked all the way up to your chest.
Yeah.
Okay? Which most people do. So unless you sleep in the fetal position, which a lot of people out there that are listening to this realize that they sleep in the fetal position because they feel better. Right now, they just realize that.
Okay.
So unless you sleep in the fetal position, so if I sleep on my side, my legs are still my hips are below 90.
Yeah.
That puts my back into extension. So again, we talked like if you're doing something all throughout the day and then you're doing it also while you sleep, and you've never undone it, right? If you've never got out of that position over and over and over again, eventually you're going to get symptoms from it. And so this pressure on this nerve, your spine stuck in this extension position, all of a sudden it's going to lead to restless leg syndrome or symptoms like it. So you're going to get pain, numbness, tingling, or cramping running down your legs. It's going to be in your thighs or in your lower legs, like the top of your foot, in your calf, bottom of your foot. You're going to get diagnosed with other conditions like plantar fasciitis and any type of like hip and knee condition that can get thrown in here, like IT band syndrome, bursitis, stuff like that. And it was all a problem in your spine because you are staying in extension and you're not getting out of that. how often throughout the day do you ever go assume something close to that like fetal position?
Yeah, never.
Only like when you're crying, well, you know.
Just if I'm getting berated by
Right.
someone or something. Yeah, no, it never happens. Yeah.
So again, it's our bodies were meant to move. Our
Right.
bodies were meant to move, and they were meant to move through a myriad of positions. And we really, more so than any time in history, we really assume one main position, and it's sitting, like this, right? Sitting where we're not that active. Even when we are active, we are still mostly doing kind of the same, like a lot of physical therapy, a lot of the active experts out there, right? When they tell you to work out, they tell you to do it in core neutral positions, right? They don't tell you to do it in different ranges.
Okay.
And for my mindset, that's wrong. You should be strong in throughout range. That's the best way to strengthen tissue, to make it healthy, to make you strong in different ranges. And you should really work in the positions that you don't often go into. And for a lot of us, it's bringing your knees to your chest. So that's why a lot of people have quote unquote tight or weak hip flexors. And it's not that they're tight, they're actually underused. So they're not getting their knees to their chest. How often throughout the day do you walk or run and your knees are coming up all the way to your chest?
Never.
When's the last time you think that happened?
Like a high.
Like a high step, but like really exaggerated.
I don't know if it's ever happened in my life, honestly.
Ever done mountain climbers? You know, you're on your hands and
those are
knees.
very difficult for me.
There you go.
Yeah.
So, well, and so there you go. So what that does is that not only brings your spine into flexion, okay, so your spine has to move into this position that we just figured out you never move into.
Right.
But then you're using your hip flexors, which they're already stuck in that extension position.
Well, let me ask you this. As someone who has, I did say I was the pinnacle of health, but let's just say theoretically someone like has a large stomach or gut. Can that affect?
Well, yeah, and because it keeps you in that position we just talked about. So pregnant women will often get these symptoms.
Yeah.
And it's because they're stuck, right? They have a mechanical obstruction, we'll call it, right? They have something blocking them from their lower lumbar spine bending forward. And the longer they go into pregnancy, not only the more that this has been going on, the longer this has been going on, but obviously the more obstructed they get. And so pregnant women often get leg cramps, restless leg syndrome, sciatica-like pain, right? And it's all basically compression of the sciatic nerve or sciatic nerve roots. Mm-hmm. And it'll get explained away just because of pregnancy, or possibly a blood flow issue, which that's valid, that's logical, right? Because the baby's compressing and decreasing some circulation. So if that's the case, as soon as you deliver, as soon as that baby gets off your
it should go away, right?
It should go away.
Yeah.
If it doesn't, it wasn't a blood flow issue, it was a nerve issue, because your spine is stuck in that position. And we just did a bunch of women's health pregnancy podcasts, and we talked a little bit about this, where nobody really tells women after birth to get out of that position, right? They don't really get the health care that they need, and they don't get the advice that they should be getting.
Yeah, so they continue that. Back to sleep, I have a couple more things personally. Say you have a partner who likes to cuddle, they throw their leg on top of you while you're trying to sleep. They're passed out, but there's this pressure kind of just sitting on like your lower back or something like that. To me, it becomes uncomfortable after a little while.
Well, you're a stomach sleeper, right?
Yes.
So she's pushing on your low back.
Yeah.
So she's pushing you more into extension.
Yeah. And that becomes uncomfortable. I assume that's probably not a good thing to continue long term.
Yeah, it probably not. And again, you go off of symptoms, right?
Right.
So if you let's say you're out there and you have a partner that throws their leg on you while you're sleeping on your stomach, I'm sure there's somebody else in the world out there like this, right? But you tolerate it just fine, and hey, maybe that's the only way you can sleep. Maybe you feel better that way, then great, that's fine.
Yeah.
But if it's uncomfortable and you're noticing these symptoms of lower back pain or pain into the legs, pain, numbness, tingling, or the jimmy legs, then no, you need to address it.
Gotcha.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
Another thing is a fan. Sleep with a fan on because I like the noise, but also the air circulation. But there's times where I feel like my back is being berated by this fan. It's cold. It makes it stiff.
Yeah, and I think that is closer to a miscorrelation of cause and effect.
That's what I was going to ask.
Yeah.
Well, not really, but yeah.
I mean, so coldness can lead to that perceived stiffness.
Okay, yes.
But, I mean, if you look up what's the best environment to sleep in, it's somewhere around 65 degrees, so which is colder than I think most people keep their rooms, right? Completely dark. So talking about coldness though, so if that's the case, then it's not the cold that's probably attributing to your stiffness. It's the position that you're in. And what happens when a nerve gets irritated, you get sensitive. So a lot of patients out there that are initially getting sciatica, or like again some of the symptoms that you're describing, right? Like that restless leg syndrome, the feeling like you need to move, like just that like jitteriness.
Yeah.
They'll actually notice some sensitivity to light touch from the blankets. The blanket's starting to piss them off. So the blanket, even on their toe, is pissing them off, or their heel touching the bed. Now all of a sudden it's starting to get sensitive where it never was before. So when your nerves get irritated, your skin can actually get sensitive to touch, or that area. So, and I think what's happening for you is that as that nerve's getting more and more irritated, now little stuff that wouldn't bother you initially is now starting to bother you, and you're noticing it.
Okay, that makes sense.
Well, and let me ask this too. I'm assuming there's nights, because you sleep with the fan all the time, right?
Yeah.
I'm assuming there's times that fan doesn't bother you at all.
Probably, yeah, for sure.
And this is something that I wrote in basically every chapter of my book. There's some signs that mean nerve symptoms, and one of those signs is if sometimes it's there, sometimes it's not. If it's kind of on and off. This is the way discs behave. Discs will put some more or no pressure on your nerve, and it'll kind of move a little bit. So you'll get this symptom, and then it won't be there. You'll go for a run, and you had a great run, you didn't have any knee pain, and then 2 days later, you go for a run, it's not even as far, it's not as intense, and you have knee pain. And then 3 days later, you go for another run, no knee pain. Well, that's not a joint issue, because if it's a joint issue, it's pretty consistent. That's more likely a nerve issue. So if you're at home and you're listening to this, if sometimes it's there, sometimes it's not, then it's more likely a nerve issue. If it's happening at rest, right, it's more likely a nerve issue. Like if you're getting lower back pain, when you're not really putting a lot of tension on your low back, if you're getting hip pain, knee pain, leg symptoms, when you're not putting any pressure on your legs, then it's a nerve symptom.
So it doesn't matter the mattress, it doesn't matter the pillow, it really doesn't matter the position. If you go to bed and you kind of undo with some stretches or some exercises what your back position has been in for the majority of the day, so that you have some flexibility in your spine, when you go to sleep, you should be strong enough, your back should be
flexible enough to that 8 hours or so of these positions that you're able to tolerate them. And you want to be careful, you can't just do these exercises right before you go to bed.
Gotcha.
Right? You have to do these exercises, honestly, the best time is early in the morning. And then throughout your day, we've been sitting here for 30 minutes or so, just sitting, leaning forward, right? Ideally, when we're done with this, you hop on your foam roller, you do a stretch, you put your neck, back all the way in the opposite position that I've been doing, so I can kind of undo that force that I've been putting on my spine in one specific direction, in one specific position for an extended period of time. So if you just wait until right before you go to bed, that's great that you kind of undid all that, right? But then you're just going to go right back to that bad position, and you've lost everything that you've worked for. So you're kind of, for lack of a better term, pissing into the wind.
Gotcha.
Right? So I tell patients, I think a good example would be, let's say I want to strengthen my biceps, right? But my elbow doesn't move. Well, the only thing I can do is this, raising my arm up and down with my elbow straight. So I'm not going to get any strength in my biceps, or very little. So first thing I need to do is get my elbow to move. Now that my elbow can move, now I can strengthen my biceps. But let's say I'm stuck like this all throughout the day, and then right before I go to bed, I get my elbow to move and I strengthen my biceps. And now I'm just going to go to sleep, and let's say my arm stays out in this position, okay? Or let's say I wake up in the morning, I get my elbow to move, and now throughout the day, anything that I do, so I'm picking up my coffee cup right now and putting it to my mouth, I'm flexing my elbow, I'm using my biceps. I'm using that throughout the day, so I'm getting more bang for my buck. So if you wake up in the morning and you get your spine out of that rounded flex position, if you get your back, low back, out of that extended position, now throughout the day when you go to tie your shoes, you're using that range that you created.
Yeah. That makes sense. I think the problem that as like a consumer is that we are berated with products that offer like solutions to all these sleep issues.
Well, when's the last product that you bought? You think?
I think I bought a pillow that was like contoured in a way that was supposed to allow my arm to go underneath.
Do you still use it?
No.
Yeah. And how about anybody at home? You know what? Start listing the products that you've bought for sleep. Anything from a Snuggie to a contoured pillow to a pillow with a hole in it to one of those body pillows. To a weighted blanket to.
Oh, the weighted blanket was the worst.
Yeah. So start listing down below in the comment section all the products that you've had, and also list too. So say the product and say if you still use it, right?
Yeah.
And so if there was a product that really helped.
Yeah.
And we'd all have it.
True.
Right? I'd have one, you'd have two, Jill would have three, right? Yeah. Jill would have a to-go Snuggie because that's the only way she can sleep on vacation, right? So if a product really worked, man, we all adopt it, and we adopt it pretty quick, right?
Yeah, I mean, there's been like a strong movement in like the past, I don't know, probably decade at this point, I'm getting old, but like where we go back to our evolutionary roots, we look at our caveman, philosophy or whatever lifestyle and compare it to now and how different it is. But it's like they slept wherever they could, right?
They slept on the ground, right? They didn't have a Tempur-Pedic, did they?
I don't think so.
Right. And we're going to say they were fine. I don't hear them complaining.
But
and so we're being a little hyperbolic, right? But like the point is that you should be able to sleep like you did when you were a kid for the most part. Right? I have 80-year-old patients that sleep on the floor or like a very rigid mattress. And so why can they do that? But then, I'm 40, you know, you're in your very late 30s.
I mean, I like to call it mid to late 30s, but
right? Why can't we sleep in that on those surfaces as well, right? Why can't a lot of people out there sleep on their stomach anymore? And it's because they just basically stopped going into that range, and now that range isn't comfortable.
Makes sense. My kid, my youngest kid, sleeps like, if you imagine like a clamshell shut, like she will fold her body in half and just sleep. And I can never wrap my mind around how in any way that's comfortable or makes any sense. But
because it used to be.
Yeah.
So you say mattresses don't matter, pillows don't matter. They do to an extent. There are some better positions. But I think what we're trying to get to the listener here is that what matters most is how healthy your spine, your joints are, and how much you move them out of a specific range. And to make it pretty simple, it's your upper back and neck get rounded, so your neck comes forward and your shoulders get rounded and your upper back gets rounded, right? So that's the typical sitting computer position.
Yeah.
Your lower back is actually the opposite direction. So when you stand, when you walk, even when you sleep, when you lay down on your back, on your stomach, on your side, your low back is stuck in extension. Most sports, gymnasts, cheerleaders, dance, even football players, specifically linemen, volleyball players, it's hyperextension. Baseball players, pitchers specifically, hyperextension of their lower back. And not a lot of sports and not a lot of activities get you away from that position. Even sitting too, for a lot of people, we blanketly say that sitting is a flex position for the lower back. I'd say actually for most people it's not. For most people, especially the people that sit up with that really good posture, You know, those people, they're in extension. They're in a good amount of extension. So if you're not undoing that throughout your day, and then you're going to sleep like that as well, over and over and over and over again, at a certain point, you know, if you keep, it's basically erosion over time, right? It's wearing away. You're literally wearing down. You're stretching muscles, tendons, ligaments on one side. You're shortening muscles, tendons, ligaments on the other side. You're stretching joint capsules on one side. You're shortening joint capsule on the other side. At a certain point, this push-pull dynamic becomes imbalanced, and now you get symptoms. And the symptoms come from compression getting put on the nerve.
Well, now I'm starting to think I should be doing these stretches because I'm also a side sleeper, so I tend to, you know, I'm all curled up, and then when I wake up in the morning, I have a lot of pain right here, like in my upper shoulders and neck. So even just sitting here, I'm like, all right, I gotta
Jill, you're young too.
I know, I'm not as elderly as you.
Elderly, I like that. A few more things I just wanted before we wrap up this podcast. I like to talk about sleep in terms of symptoms, and most people don't realize some of the symptoms that can be caused by sleep, specifically for your spine. One of the big ones is carpal tunnel. You know, so if you're getting your carpal tunnel symptoms, your hand pain, and actually carpal tunnel is typically they describe it more as like hand pain, numbness, and tingling.
Right.
But even like coldness into your arms, okay? This is because you're compressing a nerve throughout the night. And so if you're getting your symptoms while you're sleeping, if you're waking up in the middle of the night with your hands going numb, it's the same exact thing. And it's a problem coming from your spine. And you can try to change the position of when you sleep, which is very, very hard to do, okay? Most of the time when people ask me about sleep, I say, however you can get a good night's sleep, that's how you should sleep, and then you can fix it in the morning. So if you can only go to sleep with sleeping on your arms, you know, you could try to fix that. You could try to change that, but in the morning, we can just do some activity that puts you in the complete opposite position, and you should be good to go.
It's like the Dracula position.
I know a patient that she just sleeps on her back with her arms crossed like this, right?
In a coffin?
She basically like a coffin.
That's funny, yeah.
So carpal tunnel, if you're getting these symptoms, it's a nerve issue. It's coming from your neck and upper back, and it's very easy to address. But most people don't know that it's a spine issue, not a hand and wrist issue. Same thing with like your Raynaud's thoracic outlet-like syndromes that you're going to get when you sleep. So your hands go cold or numb, and they're going to say it's a circulation issue. It can be, but I've seen it more clinically respond to treating the spine, which makes it a nerve issue.
Yeah, that is really fascinating to think, like, because everybody who has a desk job or something, office job, they're going to assume it's just from them sitting at the computer or something, but it could potentially go back to even this.
Well, and it is
position.
from them sitting at the computer, but it's not from their wrists
just alone.
Yeah, it's not from their wrists resting on that. That's just honestly, that's dumb. And especially too, and I know people are going to get upset at that, right? That I'm saying it's dumb, but it is. If you're getting these symptoms when you're sleeping, then it's not from compression at the computer, right? You know, and most of this stuff is, the problem is that it is true that it's you sitting at the computer, and it is true that compression at the wrists would add to an irritation of that nerve, right? So that's where this becomes so
convoluted in a way.
Convoluted because that will, if I put a lot of pressure right here on my wrist, where the median nerve is, where the carpal tunnel is, eventually I'm going to cause some irritation or I'm going to disrupt that signal. But if the signal is already disrupted at your neck, at your upper back, the signal is already not getting there, now that extra little added compression will cause more symptoms than it should. And for most people, taking pressure off higher up at the spine will solve all of their symptoms, rather than trying to treat at the wrist. Another symptom, and we just kind of did, you know, a video or two about this, is waking up at night to have a bowel movement.
Yeah.
So is that you, Chris?
No.
You're not a night pooper?
I'm not a night pooper.
But a lot of people are, and specifically kids.
Yeah.
I'm seeing it in the younger and younger population, and this is just something, anybody that I treat, I ask them about certain positions. I ask them how they do standing, how they do walking, how they do sitting, how they do sleeping. And this is this is basically for any condition that comes up. You know, I want to know how they tolerate different positions, because I know what position your spine is in or parts of your spine are in during these positions, right? And then I also want to make sure that these are getting better. So I treat a lot of kids for lower leg conditions, plantar fasciitis, knee pain, jumper's knee, and even a lot of younger population for some GI issues. So like kids that are getting diagnosed with Crohn's or IBS or ulcerative colitis or just any of these like just general general bowel and bladder issues. And I'm noticing that their parents are typically on the call with us, and they're saying that, yeah, you know, they wake up once or twice a night to have a bowel movement. And they don't realize, A, that this isn't normal.
Yeah.
And B, that it's a symptom of compression on the nerve that is now not allowing that signal to get to your intestines. And now your intestines are kind of spasming. And now you have that feeling of needing to wake up and void. And this is one of the earliest symptoms that improve when I'm treating these patients, is that they're no longer waking up at night to have a bowel movement. They are no longer a night pooper.
Yeah, and what's concerning as a parent is you're like, it's not that big of a deal. They're up at night
right,
pooping.
They're just up at night pooping.
But 5 years from now, those symptoms develop into something that's considered Crohn's or something
which
like that.
Which is a great point. Yeah. Which is a great, because so a lot of these kids, I'm finding this symptom, but I'm treating them for plantar fasciitis. I'm treating them for, supposedly plantar fasciitis. It's a problem from the spine, So I'm treating them for something else, and the parents don't realize that this is a problem, and a problem that if left untreated will develop to something worse, right? Not only worse in symptoms, but worse in its diagnosis, and then it's going to be treated under that diagnostic umbrella. So for Crohn's, it's going to be strong medication, prednisone, so strong steroids, as well as biologics like Humira, Skyrizi, Stellaris, and it's going to be lifelong.
Yeah.
And they're going to get treatment to an area that they're going to get treatment that they don't need, and their symptoms are going to worsen.
Yeah. Yeah, that's a really good point. So I guess if you're out there listening and your kid is up at night, at least maybe consider going to the Spinal Truth and getting a consult here with Dr. Slater, because I would be, as a parent myself, I would really not want my kid to be diagnosed with Crohn's or something like that. If it could be avoided. And
it's very easy to treat in this early stage. Again, this is, I want to say, actually I've noticed a lot of the lower leg symptoms are kind of an earliest sign. But maybe the earliest sign of GI issues is this waking up at night to have a bowel movement. And again, when you treat it early on, very easy to treat. 2 to 3 sessions, so basically 2 to 3 weeks, these kids are no longer having leg pain and they're no longer having night pooping.
Night poopers.
Night poopers. It's a good term to say.
It's a good one.
So. All right, there's other conditions out there for sleeping, but I think that's our time for the show today. If you're listening to the show and we didn't address your specific condition, leave a comment down below. You can also reach out to us on TikTok, Instagram, and Facebook. You can go to thespinaltruth.com and reach out to us there. You can also schedule an appointment, a consult, or an appointment. If you have something specific, we will address it. We will try to address it on future shows, or we will reach back out to you and try to give you some advice and guidance. So that's our show for today. Tune in next week where we cover Crohn's and other GI-related issues. This should be a pretty interesting show. Don't miss it.